Thank you, Dr. Hemant. We have all gathered here for the inaugural function of the certificate course in integrative medicine.
Just model volume.
Batch.
Volume just more. Volume.
Honestly, with the 15 to 19 people in the beginning, it's went up to 30, and now we have 90, overwhelming 19 number. And in this occasion, it gives me immense pleasure to welcome Guruji H.R. Nagendraji, the Chancellor, S-VYASA University. I would say he has been the pioneer in propagating evidence-based yoga and integrative medicine in India. We're very happy that he has joined us. We welcome you heartily to this program, sir. Next with us, we have Dr. B.N. Gangadharji. He is the Chairman, National Medical Commission, President of Medical Assessment and Rating Board, Government of India. He has, with his busy schedule, he has agreed. Dr. Gangadharji has been the mentor and one of the Department of Integrative Medicine, NIMHANS, has been one of his brainchild. We're very happy, and he's been mentoring us continuously. We're very happy that he has joined us for this program. We cordially welcome you to the inaugural. Yes. And we're very happy that Dr. Pratima Murthy ma'am, Director of NIMHANS, has joined us. Very recently, she has led NIMHANS to the pinnacle of World Health Assembly by bagging the Nelson Mandela Award for Health Promotion. In her speech, she has also mentioned about NIMHANS achievements in integrative approaches, and she has been pillar behind the integrative approach and integrative medicine and the role of integrative medicine in promoting health, in health of the patient. So we welcome her very cordially, and I would also request all of us gathered here to give a applause for the achievement, which she has led from the front. So we welcome you, ma'am, and thank you very much for having supported us. Hearty congratulations for the achievement, and you are with us. We are very happy. So on behalf of all of us, I welcome you to this program. Apart from that, we have Dr. Shivram Varamballi, Professor of Psychiatry, who has been mentoring the department. He was the previous HOD of the department. Welcome you cordially to this program. And also all the participants, a huge number of participants we have in this batch, all of them belonging to various disciplines like psychology, MBBS, BAMS of healthcare. So, the diversity of various backgrounds demonstrates the popularity of CCIM, which has been organized by NIMHANS. Welcome you all. Without you, this program would not have been possible for us to conduct this program. Hope you will have a very good academic retreat over the next 6 months. So welcome all of you to this inaugural program. Thank you very much.
Thank you very much, Kishore sir. Now, I would like to give a brief presentation, the introduction to the certificate course in integrative medicine. This is the third batch. This course started in the year 2022. The course is based on the basic philosophy that has been advocated by the National Education Policy, where it is written that people exercise pluralistic choices in healthcare, especially in a country like India. Patients expose themselves to different systems of medicine. And many a times, these patients do not even reveal to their doctors that they are taking different systems. So it needs, the education policy advocates that students from modern medicine should have an understanding of Ayush system and vice versa. So therefore, with this vision of synergizing the utilization of modern and Ayush systems in the most effective and evidence-based way, that this course has been started. And the basic skills that we offer in this course is to understand the concept and philosophy of different systems of medicine and the ways of integration, wellness according to integrative health, diagnostic methods in conventional and Ayush systems and how they can support each other, management techniques and available current evidence in this area. So all doctors from all medical disciplines are available: MBBS, Ayurveda, homeopathy, Unani, Siddha, and Sova Rigpa. And I'm happy to share that doctors from all these disciplines have enrolled in this course this time. It is a 6-month course which follows a hybrid mode of teaching, 22 credits. They also involve theory credit and practical credits. They also undergo training in S-VYASA Institute and NIMHANS. And we give them assignment every week, and there are 2 case presentations. The evaluation is based on MCQ tests which happen every week, and then a final test and the case presentation. Minimum pass criteria is 80% online attendance, video presence at least 70% of time, 80% aggregate in weekly and final MCQ tests, and 80% marks in case presentations. So these are the credits that we are covering in this course, from the very basis fundamentals of different systems of medicine to the current scientific evidence and a case-based approach. Now the demographic data, currently we have 90 students who have enrolled for the course. Females are almost 3 times than the males. And you can also see that there are doctors, 46% are naturopathy and yoga physicians, 23% are Ayurveda doctors, 19% are MBBS doctors, 8% are Siddha, and another around 2% we have homeopathy, Unani, and Sova Rigpa. Then if you look at the category, here we see that consultants and faculties are a major group, along with UG students and interns forming the second largest group, and the PG students are the lesser group. Probably they are having a very hectic schedule. Major expectation for this course is enhancement in knowledge and understanding about integrative medicine, learn about different systems and practical clinical skills. Students want to know about evidence-based practices in integrative medicine, understand especially the concepts of Ayurveda and yoga and the basis of integration, integrative medicine for mental health, safety in integrating different systems, and research in integrative medicine. So with this background, I finish my presentation. And now I would like to request Professor Pratima Murthy, the Director of NIMHANS, to kindly address the gathering.
Thank you, Dr. Hemant. All my colleagues from the Department of Integrative Medicine, it's a great privilege to be amidst Dr. Nagendra, the Chancellor of S-VYASA, and Professor Gangadhar, the Chairperson of the National Medical Council, and amidst all of you today. It's very heartening to have listened to the head of the Department of Integrative Medicine telling us, Dr. Kishore told us that we've actually increased the number of candidates for the 3rd course from 19 to 90, which is, I think, something to really celebrate. The number of participants has not only increased, the specialties from which the participants come has also increased. So this is yet another very important milestone. And the 3rd, of course, is that we have people from so many different disciplines, as well as from an overrepresentation of women. And for me, that's particularly exciting that we have so many women in the healthcare profession who are doing this course. I also must emphasize that our Department of Integrative Medicine has in some ways been a trendsetter. Dr. Kishore mentioned that Dr. Gangadhar was very important in initiating this whole process and starting these services. And it's also been a trendsetter because based on the kind of learnings of our Department of Integrative Medicine, all other AIIMS have also started these programs in other AIIMS, the Departments of Integrative Medicine, or at least facilities for integrative medicine have been started in different AIIMS as well. We also know that the Niti Aayog has recommended the integration of allopathic and Indian systems of medicine, which is also a step forward. And indeed, the World Health Organization last year actually held a international meeting on looking at indigenous systems of medicine. So it's a great opportunity for all of us to come together within the disciplines of Indian systems of medicine. I know that there are participants from Ayurveda, Unani, homeopathy, Siddha, and other disciplines, including allopathy, who are going to come together. And this is very exciting because I think the whole world is looking at holistic and integrative ways of looking to treat all kinds of disorders. And within the sphere of mental health and neurological disorders, we certainly are looking for alternatives, both from the fact that they exist in our country and from the fact that the existing approaches have not paid off enough dividends. So we are constantly looking for anything that can be jointly used to help us to deal with these fairly complex conditions. 6 months will fly in a very short span of time. And I hope that all of you will have an opportunity to not only learn from my colleagues in the Department of Integrative Medicine, but more importantly, to learn from each other, to respect each other's background disciplines, and to learn what one can incorporate and integrate into one's practice, whether it's an individual practice or whether it's in an institutional practice. So I'm sure it'll be very, very rewarding. I wanted to thank S-VYASA also for their pioneering efforts in this area. And always, I think the thirst and the quest for looking at evidence base in whatever we do is another very important approach. I'm sure this kind of approach will help us to find better ways of not only treating illnesses, but also improving one's mental health and well-being. And therefore, I hope that the course will help you to address this entire spectrum from well-being and wellness to treating disorders or illnesses and making sure that patients recover and live an integrated life to the extent that is possible. And therefore, holistic well-being and health requires to be the milestone or the cornerstone around which we develop all our services. All the best to all of you. I know there are lots of people who are there online, and I hope you have a wonderful learning opportunity through this course. And once again, I congratulate the Department of Integrative Medicine for actually taking up this course and running the third successful course for such a large number of students. Thank you very much.
Thank you very much, Pratima Madam. From the Department of Integrative Medicine, I would once again like to thank you for your continuous support and guidance in this direction, Madam. Now, I would like to request Dr. H.R. Nagendra, the Chancellor, S-VYASA Yoga University, to kindly address our students. Sir, you are welcome on the dais.
Yes. My dear brothers and sisters, I congratulate our Kishorji, Hemantji, and all in the Center for Integrative Medicine in NIMHANS for taking up this course, the third batch, with 90 people. I'm so happy that you have been able to have so many people from all systems. While in NIMHANS, when they come for the actual experience, they will get exposed to the integrative medicine for mental health challenges. While they come to Prashanti Kudiram, we have now 600 beds facility for this integrative medicine with 9 different departments. We deal with all these modern NCDs: asthma, diabetes, hypertension, heart problem, epilepsy, migraine, irritable bowel syndrome, cancer, all these things. And we're getting more and more people to get the advantage of this. And many people come here not only to deal with their ailments, but also to prevent diseases. And therefore, we have a section called PPH, Promotion of Positive Health. We want more and more people also should come for PPH so that they'll be able to prevent diseases. Prevention is better than cure, we say. But do we spend time for that? This is a very important dimension that is taking place And as most of you know, S-VYASA has been able to pioneer in this, bringing into 4-digit mark in our journal publications, 1,000 research papers, and we have been able to publish them in the best of the journals. So we have today enough evidence base to see that we get this thing. When people come here, they not only get the expertise from Dr. Nagaratna and many other allopathic experts who had this thing, but also they get yoga, Ayurveda, physiotherapy, acupuncture, naturopathy, all under one roof. And you can see how the patients get wonderful results. And we monitor the changes daily on a regular basis from morning 5 o'clock up to night 10 o'clock. They're all monitored. When they go to a general hospital, probably they will get some medicines and other things, and the rest of things is for themselves. But here, morning they start with nice asanas and pranayama, meditation, and we have got various dimensions of yoga. Then they get massage and hydrotherapy, mud therapy, and many things. They go on, and we have got continuous assessment through various diagnostic tools that we have, the modern thing, not only the symptoms, but also the blood tests and several other things. And continuously, our people monitor the changes. If there is a reduction in the sugar levels for diabetes, then we continue that thing. But if there is an increase by chance, then we'll see why the increase is happening. And thereby we monitor the improvements continuously. They stay normally for 2 weeks, and sometimes they stay longer. People normally with mental challenges, they stay longer, even for a month and so on. Therefore, it's a wonderful experience that we have here with these things. And with this, we welcome all of you, my dear brothers and sisters who have joined this course, and we wish you all the best and good luck to every one of you. And we look forward to your continued enhancement of the knowledge through the complete integrative medical system. Namaskar, dhanyavad.
Namaste, Guruji. Thank you so much. Guruji is recognized as the top 2% scientist in the world who are working in the area of integrative medicine, and it is indeed, a great blessing to have guidance from Guruji. We also have Professor B.N. Gangadhar with us as the special guest. Professor B.N. Gangadhar is the ex-director of NIMHANS, and sir is currently the chairman of the National Medical Commission, Government of India. So it is indeed my great pleasure to welcome Professor B.N. Gangadhar to kindly address the gathering.
Thank you, Hemant. At the outset, pranams to Adaraniya Nagendraji, whose inspiration led me to where I am now, working in the area of integrative medicine. Incidentally, I am also a professor emeritus of integrative medicine in the Department of Integrative Medicine at NIMHANS. By that post, I have some legitimacy to be addressing all of you. This is a very novel attempt at bringing integrative medicine into reality. What keeps happening by our writings, meetings, proposals, guidelines, task force reports, they're all there as a backbone. However, the translation of all these things is in what we see as our applying into clinical practice, integrative approach to the patient's well-being. So if that has to happen, I think each of us in different professional disciplines, whether it is allopathy, Ayurveda, homeopathy, Unani, whatever may be the discipline, we generally get to know approaches from our discipline only. Integrative medicine is a single window approach to identify what is the best for this given patient. What is that this patient will benefit from? What is it that he is comfortable with? It is likely, as an allopathic doctor, I may have a patient coming to me. I assume that he wants preferably allopathy only. But this is an assumption because he has come. He has come because I was available. Would he know that there are other available people also in this field, in other disciplines? Would he know there are treatment in other disciplines which he could benefit from, perhaps even better? So our role would be to not only give the best treatment from what we have, at the same time ensure that patients would make any other alternative choice. We know today many Indian patients, why Indian? World over, patients want dual inputs or more pluralistic approaches. They want to get better, not merely that one discipline should address their problem. They're open to receiving inputs from other disciplines. In fact, some even prefer that. And some, in fact, prefer another discipline altogether rather than the discipline to which they have come. There are multiple choices that the patient may want to exercise, and we, as people who are undergoing the task force in the training here, should remember that we need to offer this, at least educate the person, even if I am not able to offer. Learn some simple procedures which we can offer through a single window system, and also ensure down the line sometime in our lifetime, integrative medicine will be the mainstream practice. I'm sure the faculty and other resource persons at the integrative medicine department will apply a lot of inputs to your education, benefit from each of these sessions. I know nearly most of them are virtual. There'll be a short period of in-person contact, clarify your doubts, start using integrative medicine in your clinical practice, or take help of other disciplines to be able to integrate the treatment to a given individual. And if your experiences, which I'm sure will be encouraging, you also in turn encourage more and more registered medical practitioners to embrace integrative medicine as an approach in their clinical practice. And this training is a prelude to it. More and more centers, I hope, will start such a training, and more people embrace integrative medicine as their clinical practice. I wish all of you all the success. Due to some difficulty in my throat, I won't be able to address you. Usually, in every batch, I take one class. Unfortunately, this today, tomorrow, I won't be able to do anything. There is an opportunity to address you some other time in a special class. I'm sure Dr. Hemant Bhargav will think about it. I am hoping to get better in the next 1 week. Wish you all the best. Thank you very much.
Thank you. Thank you very much, BNG sir. We are eager to learn from you, and we wish and pray that you get well soon. Thank you, sir. Now, towards the end of this program, I would like to invite Professor Shivrama Varampalli. Professor Shivram Varampalli is the professor of psychiatry. He is also the ex-HOD of the Department of Integrative Medicine. Professor Shivram Varampalli's pioneering work, has led to this metamorphosis of the NIMHANS Integrated Center for Yoga into the Department of Integrative Medicine. Sir has been our guiding light throughout our journey in the integrative medicine, and he continues to guide us even now. So it is my great privilege to welcome Professor Shivram Varampalli for thank you address.
Thanks, Hemant. So I'm very happy to see such a huge number of people attending this kind of a flagship course that the department runs. So good afternoon to all the participants. I want to particularly thank Dr. Pratima Murthy. I could see that she was actually traveling but she committed herself and joined for this program. Dr. Gangadhar, who has been our inspiration for the last maybe 20 years, and who is actually responsible for this kind of a center and the department coming up, and Dr. Nagendra Guruji for all of us, who has been actually working in this area for the last maybe 30 years, and has, led the way for all of us to get into this integrative medicine field, which now the world actually is looking at India. As Dr. Pratima mentioned, in Gujarat last year, the first traditional medicine conference was held, which Dr. Kishore actually attended. And actually, they are looking towards us to lead this new movement. So I thank all the support from S-VYASA, particularly Dr. Pratima as the Director of NIMHANS and the Administration of NIMHANS, and Dr. Gangadhar, who in spite of his extraordinarily busy schedule as Chairman of the NMC, keeps guiding the department whenever he is able to give time, whether it is online or offline. I also want to thank the other people behind the scenes. We can see all of us on the video, myself, Hemant, Kishore, but there are a lot of people behind these scenes. Dr. Nishita, Dr. Umesh, Dr. Shiv Kumar, the other faculty of the department, Dr. Bharat, and all the students actually who are doing work behind the scenes in the department. The support we receive from the biomedical engineering side of the NIMHANS, the support we receive from the administrative staff of the department. So it's a big 6-month course, is a very tough thing to run. It's not easy at all, and because it is a very demanding schedule, you have to be there at that point of time and coordinate all those things. So Hemant has been doing a very good job of this. So I congratulate him and all the team for doing this. And most importantly, I congratulate all of you who are part of the third batch. We have actually had very constructive feedback from the previous 2 batches, and we have taken it on board and tried to actually change the course to reflect the wishes of the participants from the last 2. Similarly, when you finish, you will take your feedback and try to improve the course. But the most interesting thing for me is to see that people from different areas can come together on a single platform and learn about how to do the best for the patient. After all, ultimately, that's our aim. Whatever research we may do, whatever else we may do, ultimately it has to be applied for the patient. So this is something that we are very happy with. I want to see more and more people from different backgrounds coming and joining this course. And I conclude my address by thanking all the participants again. We have made it a very vibrant gathering. Thank you very much.
Thank you. Thank you once again, Shivram sir. With this, we come towards the conclusion of this program. I thank Professor Kishore Kumar and all my colleagues in the department. Thank you. Namaste. Dear students, today is going to be the first class of this course, and I'm very happy to share with you that Professor Shivram Varampalli, who is the professor of psychiatry, is going to take your first class now. So before we start the class, we will have a 5-minute break. You can put your camera off, you can settle down, and we will meet again in 5 minutes. Thank you. Thank you, Shivram sir.
Yeah.